Welcome to today's video about symptoms of Piriformis Syndrome. Imagine waking up with deep pain in your buttock that makes sitting through breakfast nearly impossible. Within minutes, sharp sensations shoot down the back of your leg. You try to stand, but the discomfort intensifies. This isn't just another backache. Thousands of people experience these exact symptoms daily, yet many have never heard of Piriformis Syndrome. This condition affects a small muscle deep in your hip that can create debilitating symptoms when it malfunctions. Research published in medical journals shows that Piriformis Syndrome affects between 6 to 17% of people experiencing chronic low back and leg pain. Today, we're exploring 11 research-based symptoms documented in peer-reviewed studies from institutions including the National Institutes of Health, Cleveland Clinic, and systematic reviews published in the European Spine Journal. By understanding these warning signs, you'll know when to seek professional help. Let's discover what medical research reveals about this often misdiagnosed condition. Alright, let's jump into the list of Piriformis Syndrome symptoms, starting with number 1. Buttock pain. The hallmark symptom of Piriformis Syndrome is persistent pain in the buttock region. According to systematic reviews published in the European Spine Journal, buttock pain is the most commonly reported feature in diagnosed cases. Research from the National Center for Biotechnology Information describes this pain as deep, aching, or burning, originating from within the gluteal area rather than the surface. Patients in clinical studies consistently report difficulty pinpointing the exact location because the piriformis muscle sits deep beneath other gluteal muscles. This pain differs from typical muscle soreness following exercise. Studies published in StatPearl's medical database note that the discomfort often feels like it radiates from deep within the hip structure. The burning quality stems from the piriformis muscle's proximity to the sciatic nerve. Clinical documentation shows this buttock pain typically appears as the first noticeable symptom, often developing gradually before other symptoms emerge. The persistent nature distinguishes it from temporary muscle strains that improve with rest. Next, symptom 2. Pain radiating down the leg. The second major symptom involves pain radiating down the back of the thigh or leg, mimicking classic sciatica. Research from Cleveland Clinic indicates this occurs without the disc herniation typically causing sciatica. Published studies describe patients experiencing shooting or burning sensations, traveling from the buttock through the posterior thigh, sometimes extending to the calf or foot. This happens because the inflamed piriformis muscle compresses the sciatic nerve as it passes nearby. Medical literature terms this pseudo-sciatica since it produces sciatic-type symptoms without spinal involvement. According to research in physical medicine and rehabilitation journals, this symptom creates diagnostic challenges as patients often undergo extensive spinal imaging searching for disc problems that don't exist. The pain intensity varies significantly between individuals. Some experience mild tingling running down their leg, while others report severe lightning bolt sensations. This radiating pattern frequently leads to misdiagnosis, with patients pursuing spinal treatments when the actual problem originates from the piriformis muscle compressing the nerve. Next, symptom 3. Numbness or tingling. Numbness or tingling sensations, medically called paresthesia, represent the third key symptom. Research published by the National Institutes of Health notes that numbness in the buttocks and tingling along the sciatic nerve distribution occur commonly in Piriformis Syndrome. Studies document this results from direct nerve compression by the dysfunctional piriformis muscle. Patients describe pins and needles feelings, intermittent numbness, or electrical tingling sensations. According to clinical research, these neurological symptoms indicate sciatic nerve compromise through compression or inflammation. The unpredictability characterizes this symptom. Paresthesia may appear suddenly while sitting, intensify during certain movements, or persist constantly. Medical literature from Cedars-Sinai emphasizes these sensations follow the sciatic nerve's anatomical pathway down the leg, sometimes extending to specific foot areas. Research in neurology journals notes that some individuals experience paresthesia more prominently than pain. The intermittent nature distinguishes Piriformis syndrome from constant numbness, seen in severe nerve damage, suggesting early intervention can prevent permanent injury. Next, symptom 4, pain. Worsened by prolonged sitting research consistently identifies pain aggravated by prolonged sitting as a defining symptom. According to systematic reviews in the European Spine Journal, sitting for extended periods ranks among the most commonly reported aggravating factors. Clinical studies show sitting places the piriformis muscle in positions that increase tension and pressure on the underlying sciatic nerve. Research published in PM&ER journal documents that sitting causes the muscle to gradually tighten, compressing the nerve more forcefully. Patients in clinical observations frequently shift their weight, sit on one hip, or stand repeatedly seeking relief. Medical literature notes that activities like climbing stairs, prolonged walking, or running also trigger increased pain. Studies indicate these weight-bearing activities require repetitive piriformis contraction and stretching, causing inflammation and spasm. Research emphasizes this symptom significantly impacts quality of life since modern lifestyles demand prolonged sitting for work and commuting. The predictable nature of sitting-induced pain serves as a diagnostic tool. Next, symptom 5, pain with specific hip movements. The fifth symptom involves pain triggered by specific hip movements that stress the piriformis muscle, particularly hip adduction combined with internal rotation. Research in diagnostic medicine shows these movements place maximum stress on the piriformis muscle, reliably provoking symptoms in affected individuals. Clinical examination protocols documented in medical journals utilize these movements as diagnostic tests. Studies published in Physical Medicine and Rehabilitation Research note that when the piriformis muscle is inflamed or spasming, stretching it through specific hip positions reproduces symptoms almost immediately. According to clinical research, patients unknowingly avoid these movements in daily life, adapting their gait and posture to minimize stress. Simple activities like crossing legs, entering cars, or putting on shoes can become painful when these movements stretch the irritated muscle. Medical literature documents this symptom appears during physical examination through specific tests including the FAIR test, which systematically moves the hip through positions stressing the piriformis muscle. Next symptom, 6, external tenderness. Over the greater sciatic notch. Systematic reviews identify external tenderness near the greater sciatic notch as another common symptom. Research published in the European Spine Journal lists this tenderness among the most frequently reported features. This anatomical landmark, located deep in the buttock, is where the sciatic nerve passes close to the piriformis muscle. Clinical examination journals describe how practitioners palpate this deep muscle through overlying tissues, assessing for abnormal tenderness or tension. According to medical research, pressing this specific spot often reproduces the patient's familiar deep buttock pain or triggers radiating leg sensations. Studies emphasize this localized tenderness distinguishes Piriformis syndrome from generalized hip or back conditions. When pressure applied to the piriformis region recreates exact symptoms, it provides strong evidence this muscle is the pain source. Research documents the tenderness often feels different from typical muscle soreness. Patients describe it as deep, bruised sensation, or report the muscle feels abnormally firm or tight. This physical finding becomes valuable when imaging fails to reveal spinal abnormalities. Next, symptom 7. Limitation of straight leg raising. Research documents limitation of straight leg raising as a notable symptom. According to the updated systematic review published in the European Journal of Orthopedic Surgery and Traumatology, this limitation appears among commonly reported features. Studies indicate that raising the leg while keeping it straight can reproduce or intensify symptoms when the piriformis muscle is involved. This occurs because the movement stretches posterior hip structures, including the piriformis muscle. Clinical research notes this differs from the classic straight leg raise test used for disc herniation. According to medical literature, while patients with lumbar radiculopathy typically show positive straight leg raise tests, those with Piriformis syndrome may demonstrate pain or limitation during this maneuver for different mechanical reasons. The piriformis muscle's role in hip stabilization means that elevation of the extended leg can stress this deep muscle. Research emphasizes that healthcare providers must distinguish between spinal and muscular causes when this test produces pain. Next, symptom 8. Pain. When changing position. Pain triggered when changing positions, particularly rising from sitting or getting out of bed, represents another documented symptom. Medical research indicates these transitional movements place unique demands on the piriformis muscle, requiring forceful contraction while simultaneously stretching. For an already inflamed and spasming muscle, these dynamic movements become painful triggers. Clinical observations published in medical databases reveal patients often report the initial movement is most painful, with discomfort gradually subsiding once fully upright and moving. Studies document this occurs because the piriformis muscle functions as a hip stabilizer and external rotator. When rising from sitting, this muscle must contract to help stabilize the pelvis during weight transfer. Research shows that for individuals with Piriformis syndrome, this necessary muscle activation compresses an already irritated sciatic nerve, creating immediate pain. Medical literature documents patients often develop compensatory strategies, such as pushing off with arms to minimize hip muscle engagement. Next, symptom 9. Pain, mimicking lower back pain. Research identifies hip or gluteal pain that mimics lower back pain as a common source of diagnostic confusion. Studies published in spine journals emphasize this symptom occurs without obvious disc herniation or spinal abnormality signs. According to neurology research, the brain often struggles to precisely localize pain from deep pelvic and hip structures. The piriformis muscle's anatomical location means sensory signals can be interpreted as either hip pain or lower back pain. Clinical studies reveal patients frequently report pain in the lower back area, when examination shows the actual source is the deep gluteal region. Medical literature documents this leads to extensive spinal imaging, including MRI and CT scans, searching for disc problems or spinal stenosis. When these studies return normal or show only minor age-related changes, both patients and providers feel frustrated. Research emphasizes the key distinguishing feature is that Piriformis syndrome lacks typical spinal pathology signs, such as specific dermatomal numbness patterns or reflex loss. Next, symptom 10. Pelvic or perineal discomfort. Research documents less commonly reported but significant pelvic or perineal region discomfort. Medical literature indicates patients sometimes hesitate discussing pain in intimate areas and may not connect it to buttock symptoms. Clinical studies show the piriformis muscle's anatomical proximity to pelvic floor structures and complex nerve networks can create referred pain extending into unexpected areas. According to research published in medical databases, the pudendal nerve, which supplies sensation to the perineal region, travels near the piriformis muscle and can be affected by inflammation. Studies document patients describing unusual pressure, aching, or burning in the pelvic floor, sometimes with sensations suggesting need for bowel movement when unnecessary. Medical research indicates some patients report gender-specific symptoms like testicular discomfort in males or labial pain in females, potentially leading to extensive urological or gynecological investigations before identifying the true source. Healthcare literature emphasizes this symptom particularly impacts quality of life, affecting intimate functions and creating anxiety about sexual activity, urination, or bowel movements. Next, symptom 11. Muscle stiffness or spasm. The final symptom addresses the underlying mechanism, persistent stiffness or spasm in the piriformis muscle itself. Clinical research documents this represents both a subjective patient sensation and an objective examination finding. According to medical studies, patients describe feeling a knot deep in their buttock, a tight band that won't release despite stretching, or constant tension making the hip region feel restricted. Research published in neurology journals indicates muscle spasm develops through various mechanisms, including direct trauma, overuse, prolonged sitting stressing the muscle, or protective responses to adjacent structure injuries. Studies show that once established, spasm creates a self-perpetuating cycle. The tight muscle compresses the sciatic nerve, causing pain and neurological symptoms, which triggers more muscle guarding and spasm. Medical literature emphasizes this muscle dysfunction is the cornerstone of Piriformis syndrome pathophysiology. When the piriformis remains contracted and spasmodic, it cannot relax enough to release pressure on the sciatic nerve. Research indicates successful treatment must directly address this muscle spasm. By understanding these 11 research-based symptoms helps you recognize warning signs and seek appropriate medical attention. Experiencing these symptoms doesn't definitively confirm Piriformis syndrome, as many conditions produce similar complaints. Professional evaluation remains essential. Healthcare providers can perform specific physical examinations and diagnostic tests to confirm the diagnosis. Research indicates approximately 85% of people recover with non-surgical treatments, including physical therapy and stretching exercises. Early recognition prevents chronic pain and nerve damage. If you're experiencing these symptoms, document what worsens or improves them, then consult your healthcare provider. If this video helped you understand Piriformis syndrome, kindly type "helpful" in the comments. Your feedback motivates us. Please like, share with anyone who might benefit, and subscribe for more research-backed health information. Thank you for watching.